and welcome to the Mental Health Hub. Today's episode is a continuation of what we started, where we are trying to understand addiction. Oftentimes people ask themselves, why would somebody indulge in an habit, so to speak, whereby their life is being destroyed, everything around them seems to fail, their health is failing, their resources are failing them, the relationships are being destroyed, they are becoming physically ill in many ways. So people try to understand why this addiction. Why would someone actually indulge in addiction or become a person using a substance to an extent that it is uncontrollable? So as I said last time, science has been able to unveil and explain through research, through experiments, why addiction, so that it can help us really unravel this, so that families can be able to understand, so that individuals can be able to understand, so that the people intervening can be able to understand, so that then we know how do we go about this issue of addiction, so that we can be able to help people that are using substances, so that also we can be able to help the families and the other people who are being affected by the use of substances of their significant other. So then I want to pursue the bit of why addiction. And today I want to look at addiction as a medical or as a disease, as it were. It's a disease like any other, where we would be able to look to say the disease cancer, the disease high blood pressure, diabetes, or any other chronic disease that we know physically. So can we be able to understand addiction as a disease? Why is it important to understand that, even as science has been able to reveal to us, so that then we can be able to appreciate the fact that this is a person who is actually sick in real sense of sickness. And worse still, this is a brain disease that has been evaluated and found to be a chronic relapsing disease. Chronic as in that it will affect this person for a long time, and it can recur even when somebody stops. The likelihood of recurring or one relapsing is very much there. So then how do we understand addiction as a disease? Addiction is as a disease because even according to the World Health Organization's understanding of a disease, there are 4 or so aspects of disease that really qualifies addiction as a disease. First and foremost is the etiology, or a traceable cause. What is a traceable cause? What could be the cause of addiction? Just like any other disease, like the way we would say that malaria is caused by this pathogen, that diarrhea is caused by this, that cancer is caused by this. So we can also be able to understand the cause of addiction just like any other disease, where we would say maybe this was because of trauma that was experienced at childhood. Maybe this is because somebody is trying to medicate on an underlying mental disorder, or even it is because of medication that they are taking for a certain disease that has maybe predisposed them to becoming addicted to a substance of choice. So it is traceable. There is an etiology, just like any other disease. That qualifies it in one way to be a disease. The other qualification is that it has an identifier of signs and symptoms. Just like the other diseases that you can say the symptoms of malaria is high fever, the symptoms of malaria is headache, the symptoms of malaria is this and the other. The same way you can be able to say for somebody addicted to alcohol, these are the signs and symptoms. What do we do? What do we see to be able to identify that actually this person is addicted? something like tolerance, something like withdrawal symptoms. So these are signs and symptoms, or the behavior of the person. This is noticeable, just like any other disease. That's another qualifier of addiction being a disease. And we need to be able to understand that. Another thing is that it has a prognosis or a predictable course. You can be able to say, if this disease, once you have been able to identify it, if it is not treated in this period of time, according to science, it will lead to this. Let's say for HIV, when one gets infected with HIV, they can be asymptomatic for a period of time, but they start developing symptoms. And then if this is not managed well, then it can lead to death. Just the same way with addiction, you can be able to say, this is the cause of it. If nothing is done, when we have identified that somebody is at the experimentation stage of the disease progression, if nothing is done, this person will become an habitual user. After becoming an habitual user, this person becomes dependent if we have to go that process of addiction. So from one step to another, from one step to another. And if no intervention is put in place, this can actually kill this person. It lowers the quality of life of a person, just like any other disease. Another thing is that it has a prognosis or a predictable outcome. It will lead to this. It can lead to death. It will lead to a dysfunctional life. It will lead to malfunctions of some organs in the body, just like any other disease that can compromise an organ of the body to an extent that one can develop a kidney problem, one can develop another mental health condition. It has a prognosis, or there are outcomes to addiction. It will lead to dysfunction at the family level. It can make relationships to be destroyed at the family or even at the workplace. So there are outcomes. There are predictable outcomes. If no intervention is put in place, this is the likely outcome of addiction. And also another identifier of the same as addiction as a disease, it has lack of intentional causality. What do I mean? There is no one who wants to actually become dependent on a substance or another. No one starts to smoke saying that I want to smoke, I start this one cigarette, and I want by the end of the month, I am smoking like 20 cigarettes per day. Nobody starts that way. Nobody starts taking alcohol with the intention of as I start with a beer, I want to progress and start taking wines and start progress to maybe spirits. Or I start taking alcohol with the intention of I have started with 2 beers, by the end of the month maybe I want to be taking that. It has no intentional causality. No one starts with the intention of getting addicted. Just like any other disease, no one can actually expose themselves to a disease knowingly. That is what it really means, that there is no intentional causality. No one wants to become addicted, even by the time they are starting to use a substance. They don't intend to become abusers. They don't intend to become addicted. This is important, that we be able to identify that, so that then we can say, just like any other disease, addiction qualifies in those 5 components, that it has an etiology, that is, it has a traceable cause. You can trace, it begins here, it goes this way, it goes this way, and the likely this is the end part for one getting addicted. It has identifiable signs and symptoms. That's the second identifier of it as a disease, that explains it as a disease. Also, there is a predictable course from this point to the other point. It has also a prognosis that predictable outcome. This is what is likely to happen, and then there is lack of causality. Why is it important for us to understand that? Because even at family level, when somebody, you'll hear a mother say that my child is taking alcohol in excess, they have become addicted, and it is becoming a challenge at the family level. And you hear that the child is likely to drop out of school, or they are being thrown out of school because of addiction. Or and at the workplace, you find a colleague who has become addicted, and they are disciplined until they are being threatened with maybe termination of service. Or somebody has become addicted and they are struggling to stop, and people are telling them, please stop this. Why did you begin taking alcohol in the first place? It is your choice that you made. You decided to become an addict. It is not a choice. Once we are able to understand that it is a disease, then we will be able to support the person who is actually become addicted to a substance. We will be able to, or we can actually intervene with the understanding that this person is also struggling to come out of this chronic relapsing disease. We can be able to appreciate the fact that when they tell themselves, this is the last beer I'm taking, this is the last cigarette I am smoking, come next year as I start the new year, you know those resolutions that we make, or oftentimes people make at the end of the year as we enter into a new year. People, somebody who has become addicted or dependent on a certain substance makes a resolution that beginning from January, 1st of January of this next year, I will not take alcohol anymore. I will not indulge into this cocaine. It has destroyed my life. I will not take heroin again. I am going to stop. They are intending to do so. But being a disease, just like any other, they have lost control. So I'm bringing this out so that we can be able to appreciate the fact that this person is struggling. And if we understand that this person is struggling, they didn't intend to become addicted, they didn't intend to become dependent on a substance, then we can give them the benefit of doubt and be able to support them even as they try on the path of recovery. That is where a mother can say, wow, I realize that really this is a disease and my child is really suffering. So then they can reach out to a professional, and the professional will be able to give them the necessary information that the professional will be able to do an identification. What could be the cause of this addiction of this child? What may have led to this person getting addicted? At what level of addiction is this person? At what level is this disease? Is it mild? Is it moderate? Is it severe? Just like any other disease. Then a course of treatment. We will draw a plan of treatment knowing that it is a disease with a professional, so that they can be able to say, from here we go to this. From identifying if there are any other underlying issues, then we can be able to move forward. When you identify the underlying issue, then you start also dealing with the underlying issue. If it is another mental disorder that this person has, then you also treat the other mental disorder so that you can be able to manage the substance use disorder. On the other hand, you can also be able to tell yourself that this is where this person is and offer them the support that they need. Is this a psychiatric condition that requires medicine? The doctor can be able to say, does this require medicine? So that we can introduce medicine. Does this require only psychotherapy or education, information sharing, and counseling, whereby the underlying issue, if it is a psychological issue, the professional go into the depth with the client to be able to unravel these underlying issues. Maybe it is about anger management. Maybe it is about inability to manage their life, to make decisions. Maybe it is because of a low self-esteem, that this person has a low self-esteem that needs to be addressed, so that then the mental health issue can be addressed, or the substance use disorder can be addressed. So when we are able to understand addiction as a disease, just like any other disease, then even at the workplace, we can support the people who have been diagnosed with a substance use disorder. You can be able to offer support. Also, this other person, the person who is having the substance use disorder, can actually gain the understanding that I'm actually sick. And if then I'm sick, I need to adhere to the treatment that I'm being given, because I have realized I am sick. It is not a choice. It is not because I chose to be sick. It is because of the situations that I found myself in. It is because of this underlying other mental disorder that I didn't know that I was managing with the substance of choice until it progressed to an addiction. So even this person who is actually a person living with a person who has an addiction, they are able to appreciate that they really need to work on themselves. They also need to be able to understand it is a chronic relapsing disorder. Yes, I have been treated. I'm on remission for a period of time. I need to be able to appreciate or understand there are triggers that can make me relapse, because I have a chronic relapsing disorder. So, with the support of the professional, I can be able to identify the triggers. Is the trigger a place that I go to? Is a trigger the people that I relate with? Is the trigger the paraphernalia that I find myself with? Looking at, maybe if you have photos in your house of your choice of brand of beer, that can be a trigger. So you need to be able to pull down that photo. If it is the places you visit, when you go to a certain place, you see the bar that you are used to, the place that you are used to buying your substance, and it triggers you, it triggers the memories of you wanting to actually go there again, and it can lead you down the lane of drinking again. Or it is the company that you used to keep. So when you are able to identify these triggers as the person in recovery, by the fact that you appreciate that this is a disease like any other, it is not a choice, it is not a curse, it is not because you are weak, it is not because you are a failure, it's not because you are a sinner, it is not because you have failed in life, because you are disobedient. When you are able to pick that, then as a person, you can really work hard on yourself, knowing that you are treating a disease. And I hope this information will really be able to inform a family member, will be able to inform an individual who is struggling with the substance use disorder, or even a workplace or a society where they are trying to ask, is it that we are cursed? Is it that our race has a problem? Is it that our county or our country has a big problem? What are these things that are happening? If we can be able to take that one thought that it is a disease, then we can enhance management strategies, whereby we can even ensure that we have treatment facilities that are there to support the people living with addiction. That's why a society can be able to identify this is a disease that is a need in the society, and they put in place the necessary infrastructure, and they put the necessary resources in place so that you can be able to help your people in the locality, so that then we can be able to prioritize mental health issues as diseases like any other disease. And I hope that information is able to help you. Thank you. I'll see you in the next episode.